second opinion, your thoughts and what the states have to live under now, and what rights and opportunities the states should have.
Well, Mr. President,
Senator from Texas.
I certainly appreciate what Dr. Barrasso, Senator Barrasso from Wyoming does for us on a regular basis, and that is as one of the few physicians in our body, to be exact, and he is one of the two. He tells us the things that are happening in this health care reform bill that are hurting our healthcare system, hurting the quality of healthcare in our country, and at a time when we need to assure senior citizens that the Medicare cuts will not take effect, and as we certainly want our small businesses to hire people rather than stop at 50, because then they're going to start getting fines for not giving the government prescribed health care that is in the Health Care Reform Act that was passed last year. And so what I'm doing in my amendment is one of those pending in the bill that is before us is saying, stop. We have now had two federal courts, one from Virginia, one from Florida, that have said this law is unconstitutional. And yet the administration is continuing to implement the law, even though it has certainly now been called into question. I am most affected by the number of states that are having to do the same thing. Most of our state legislatures are in session right now. Every one of them, actually I think approximately 44 states out of 50, have budget shortfalls. And yet our states are having to spend millions and hundreds of millions of dollars to implement a law that may be declared unconstitutional. Some states have said we're not going to implement. But if they say that, then they are going to be in jeopardy when they're not prepared if the law is constitutional, and they will be paying late fees and fines for not implementing during this kind of time when we're in limbo. Some states are saying, well, we're going to go ahead and implement, but we have a budget shortfall and we would really like not to be required to implement a law that may be void, and we're spending millions of dollars when we really need that money for education, frankly, or Medicaid. So my amendment just says we will stop any further implementation of this law until we know the final court opinion has been rendered by the Supreme Court of the United States whether or not the law is valid. That's it. That's it. Simple, clear. We will just let every state know and have a level playing field that you do not have to spend the hundreds of millions of dollars that are now being spent on implementation unless we know the Supreme Court has said the law is valid. I have 36 co-sponsors of my amendment, including the senator from Wyoming, who is one of our two physicians in the Senate. And I think that we will have a large support because I'm getting letters from organizations. I got a letter from a group that has been formed to say we really need to start over on this health care reform bill. And these are people who represent the employers of America, the employers who want to be able to give their employees the health care coverage that they can afford right now. It may not be the government prescribed health care, but many are trying to do it. And the groups that have signed this letter supporting my amendment to say stop implementation now are the Associated Builders and Contractors, the Associated General Contractors, the electrical contractors, the food service distributors, the international franchisees, the National Association of Manufacturers, the National Association of Wholesaler Distributors, the National Retail Federation, the Small Business and Entrepreneurship Council, the United States Chamber of Commerce. and the Independent Women's Voice, the 60 Plus Association. These are the groups that are saying, let's stop the upheaval that this has caused in our country, and let's wait and see what the Supreme Court says before we have the outlays of millions of dollars. And most certainly the small businesses that are not increasing their employment because they are so concerned about the implications of this health care reform bill. Let me just give the senator from Wyoming an example from my home state of Corpus Christi. A small business in Corpus Christi, Texas, has 34 employees. The cheapest option that they have for their health insurance renewal is 44% more than their insurance just last year. They have just days to decide whether they can continue to offer their employees health insurance. Now, this is in anticipation of the health reform bill going into effect and causing these employers to have to meet these new mandates. The insurance companies are already ratcheting up their insurance premiums in anticipation of this law. This is one of the key reasons that we need to stop the implementation until we know if this law is valid, so that our businesses will have the freedom to provide affordable health care coverage to their employees. So, Mr. President, I thank the senator from Wyoming for coming in with his second opinion, because we know that he has unique experience working with our healthcare system, and I want to make sure that we don't do what the physician motto is, and that is harm when we haven't thought it through and we don't have all the ramifications. First, do no harm. That's what the motto is. It's simple and clear. And I think we need to stop implementing this bill until the Supreme Court has ruled on its constitutionality. Thank you, Mr. President. And I thank the senator from Wyoming.
Mr. President, just to follow on that, I'm so pleased to be a co-sponsor, an original co-sponsor of the Save Our States Act. States are very concerned. As I heard my colleague from Texas say, there are 44 states are in the red right now. And when you hear the complaints from governors of both parties, they are both having to live under this law, have great concerns at. Some states, as my colleague from Texas knows, have actually applied for waivers so they don't have to live under the constraints of the law. The state of Maine has been given a waiver. 2.5 million Americans have been given waivers by the Secretary of Health and Human Service. Many of those are union workers and who actually supported the